Hey, today I wanted to talk about a recent decision made by NHS England when it comes to diagnosing breast cancer to women under the age of 40. Now, at the moment, regardless of your age, you will get through, once you have a referral from your GP, you will go through to a breast cancer specialist, usually in a breast centre. There, you will be examined by a breast cancer specialist physically, and then they will send you for a mammogram or an ultrasound scan. After that, they will usually carry out a biopsy. Now, it's worth mentioning that this way of doing it has a 99.6% accuracy rate. It's wonderful, absolutely wonderful. Now, what they are proposing to happen is that because breast cancer is so uncommon for women under the age of 40, is to put a virtual clinic in between the GP referral and the breast cancer centre / breast cancer specialist. Now, the worry with this is not only will this delay people from getting from the referral to actually being seen, it can also act as a barrier. So the people that will be referred from the GP can also get sent straight to imaging if they're lucky enough to get that far. And then once they're seen by imaging, the worry is there might not be certain cancers that might not be picked up. Now, that is rare and uncommon, but it does happen. Not all cancer lumps can be seen in imaging. They can only be felt. So, with breast cancer, it is the biggest killer of women under 50 in the UK. So, there is obviously something not quite right there. There are already too many young women slipping through the net. And the way I see it, they're trying to make these holes bigger, meaning we're going to lose more people. Now, to go off on a tangent a little bit, but it is relevant, I promise you, is when it comes to metastatic breast cancer, or secondary breast cancer, as it's also known, there are no, how can I put this? There's no data. There is literally no data. So the government does not know how many people are living with metastatic breast cancer in the UK right now. Any data we do have is severely outdated. Now, this is important because any of these women that might fall through the net in a year or two's time will go on to develop metastatic breast cancer. So even though on the statistics it will look like that these referrals have gone down and they've managed to sift through more people, there will be a significant amount of people, and in this case uncommon does mean many thousands of women. The uncommon statistic then, if you like, will mean that these women will just get lost. So they will look like they have less referrals on one chart, but because there is no record of people with metastatic breast cancer, they will just get lost. So it will look like they're doing great and hitting targets on one thing, but on the other, it just means there's more and more and more young women with metastatic breast cancer, which is absolutely unacceptable. Now, there are other more pinpointed ways why this can be seen as an issue. Firstly, this would rely a little bit more on your GP. So at the moment, your GP, as great as they are not breast cancer specialists. So once they're not sure of something, they will refer you through to someone who knows a little bit more within that field. They have to pass that information forward to the virtual clinic in the middle. Now, you know how wonderful hospitals can be sometimes when it comes to communication. So that's one worry. The second worry is the patients themselves. Now, I don't know about you, but this is certainly true for me. When I was first diagnosed, I didn't know the right things to say. I didn't know how to quite articulate what I was feeling. Even when I was being questioned, I was so nervous about saying the right thing or the wrong thing. And many patients might play it up and some might play it way down. In which case, when the expert is not in the room with you to physically check you and be with you and read your emotions and just those very human, interactions that you have, then the worry is that someone might have something serious like breast cancer and it might not get taken further forward because of what in the video consultation, the right keywords might not have been picked up. That's another person falling through the net. One of the other last reasons, there are many reasons, but I'm just keeping this one short for today, is that the complete impersonal feeling from point A all the way across. From the moment of your GP referral, it will, other than the nurse that will operate to, squeeze your breast in a mammogram, that'll be the only human contact you kind of have. All the rest of it will be virtual. Imagine if the worst happened and you had your breast cancer diagnosis over the phone. I get it, times are hard with COVID. There is definitely another way to do this, surely. This is just, there's no greater way for this country to show that they just do not care about people developing breast cancer. So, just to finish up, I just want to mention a little bit about my own experience and why this is so important to me. In my primary breast cancer diagnosis, in 2016, by the way, so this was a long, long time before COVID, it took me 8 weeks from being referred to my GP all the way up to being seen in the breast centre, and that still included a lot of phone calls and a lot of chasing. My secondary breast cancer diagnosis wasn't so straightforward. Essentially, I went to my GP 10 times within a month. Having been looked at 10 times by different doctors, nurses, physicians, I was essentially referred to a kidney scan, which obviously was wrong. But whilst waiting for that kidney scan, I was driving to work one day and I blacked out and collapsed on the roadside and lost my ability to walk for a couple of months. Only intensive physio got that back. And they weren't able, my GP was not able to pick up on those symptoms of severe secondary breast cancer in the bones, to lead to that level of pain. So forgive me for feeling a little bit distrusting about GPs and virtual specialists being able to pick up an already elusive, insidious disease. So to finish off, if you are worried about this and this is directly affecting you, I would recommend seeking out a nurse from Breast Cancer Now or somewhere like Macmillan, even Maggie's. The list is not, exhaustive, just whatever works for you. Have a chat with them and get to know a little bit more about the process. See if that makes you feel a little bit more comfortable, or even just someone to talk to. If you want to have a little bit more of a proactive approach, I would strongly advise you to write to your MP or at them on Twitter. Just let them be aware. They're not always aware of some of these changes and how this is going to negatively affect you. And last but not least, when you are, or I'm sorry if you are, the one in that consultation, do not take no for an answer. If you are scared and are sure that there might be something not quite right, push. Push to get past that virtual assessment.